Welcome to this video on morphological markers in fetal heart development, focusing on normal cardiac structures. Written by Lachelle Jones with UltraPro Cert. As we explore these structures, remember that, in a world of shades and shadows, it takes the clarity of black and white to truly see the bigger picture. The four-chamber heart makes up about 1/3 of the fetal chest. Its apex points to the left, which is levocardia, at an angle of 45 degrees. The heart is positioned in the left chest, or levo position, and the descending aorta is to the left of the spine. When examining the descending aorta, note that a 45-degree angle is considered normal. Left-sided aorta is to the left of the spine, while the right-sided aorta is located to the right of the spine at roughly a 60-degree angle. The AV valves form the crux of the heart. The tricuspid valve inserts into the right ventricle, and the mitral valve into the left ventricle. The IVS, IAS, and AV valves define the center of the heart. The apical offset in the four-chamber view shows the tricuspid valve inserting lower, or more apically, on the septum than the mitral valve. This seagull in flight appearance is normal and known as apical offset. A linear insertion of the AV valves, where they insert at the same level on the septum, is an abnormal finding. This appearance is a red flag for an atrioventricular septal defect, or AVSD. The atrioventricular, or inflow valves, are the mitral on the left and the tricuspid on the right. The semilunar, or outflow valves, are the aortic on the left, which has no bifurcation, and the pulmonary on the right, which has a Y-shaped bifurcation. The right ventricle is the most anterior chamber and is crescent-shaped. Key features include the moderator band near the apex and the tricuspid valve inserting more apically than the mitral valve. The left ventricle is smooth, has a thicker wall, and is bullet-shaped. It gives the apex and contains the bicuspid atrioventricular or mitral valve. There is no moderator band in the left ventricle. The left atrium is the most posterior chamber and is closest to the descending aorta and spine. It receives 4 pulmonary veins and contains the foramen ovale flap. The coronary sinus is adjacent and posterior to the mitral valve annulus and enters the right atrium. In fetal circulation, it is the primary vessel returning deoxygenated blood from the heart muscle to the right atrium. The right atrium receives the SVC, IVC, and coronary sinus. It has a pyramidal right atrial appendage, a Chari network, and pectinate muscles lining. The IVS inserts near the interatrial septum, with the eustachian valve opening. The right ventricular outflow tract, or RVOT, comes off the right ventricle and points towards the fetal left shoulder. The key distinguishing feature is the bifurcation of the pulmonary artery into the LPA and RPA. The left ventricular outflow tract, or LVOT, comes off the left ventricle and points towards the fetal right shoulder. When evaluating the LVOT, ensure you see the mitral valve and the aortic valve. The RVOT pathway involves the pulmonary valve, pulmonary artery, ductus arteriosus, and descending aorta. The pulmonary artery crosses over the aorta prior to its bifurcation. The LVOT pathway includes the aortic valve, ascending aorta, aortic arch, and descending aorta. This is seen in the 5-chamber view, angled towards the fetus's right shoulder. The aortic arch arises centrally from the left ventricle and ascending aorta. It has 3 branches: the brachiocephalic, left common carotid, and left subclavian arteries. It is often described as resembling a, quote, candy cane. By moving the transducer from the aortic arch view towards the left, you can see the hockey stick-shaped ductal arch. This arch displays the right ventricle, pulmonary valve, main pulmonary artery, and descending aorta, and it does not have any branches. Short axis views help visualize the ventricular septum, papillary muscles, and mitral valve in different cross-sections. This image shows a short axis view. Here we see the AV valves, the tricuspid valve, the IVS, and the mitral valve in a short axis sweep. Thank you for joining me. Please send any questions or feedback to ultraprocertllc@gmail.com. Our next topics will cover finishing up cardiac anatomy, fetal situs, and fetal circulation step by step.